Good afternoon, everyone. I am Prabhakar, Associate Professor, SNS College of Nursing. Today, we're going to discuss about palliative care services in India. Definition: palliative care is an approach that improves the quality of life of patients and their relatives facing problems associated with life-threatening illnesses. It focuses on prevention and relief of suffering through early identification, impeccable assessment, and treatment of pain and other problems like physical, psychosocial, and spiritual. The key principles would be respect life, regards dying as a normal process, intends neither to hasten nor postpone death, integrates the psychological and spiritual aspects of patient, offers a support system to help patients as actively as possible until death, and the family to cope during the illness and the bereavement. Continuum of care. Palliative care begins as a support care at the time of diagnosing of life-threatening illnesses. It continues as terminal care if illness progresses until the patient's death. It runs in conjunction with the disease-modifying treatments such as chemotherapy and radiotherapy. Palliative care is an integrated system of care conducting and guiding patients through comprehensive array of health services which is available. Who needs palliative care in India? As estimated, 5.4 million people in a year in India needs palliative care. Other estimates suggest at least 7.2 to 7.5 million people annually would need palliative care. Majority of adults in need of chronic diseases such as cardiovascular disease, cancer, chronic respiratory disease, AIDS, and diabetes. Other conditions include kidney failure, chronic liver disease, rheumatoid arthritis, neurological diseases, dementia, congenital anomalies, and drug-resistant tuberculosis. Approximately 80% of all cancer patients are diagnosed in very advanced stages, making palliative care absolutely essential for them. Historical development in India, early initiatives. The concept of palliative care was introduced in India in mid-80s. In 1986, the first hospice, Shanti Aventa Ashramam, was opened in Mumbai, Maharashtra. Late 90s, early 90s, the palliative care facilities were established in cancer centers in Ahmedabad, Bangalore, Mumbai, Trivandrum, and Delhi. In 1983, Pain and Palliative Care Society, that PPS, was formed in Calicut, Kerala, emphasizing community involvement. In 1994, Indian Association of Palliative Care, IAPC, was formed with multidisciplinary approach to care for palliative patients. Historical development in India, key milestones are: in 1997, CAN support was formed in Delhi, which provides first free palliative care home care support services in northern India. In 1998, Government of India instructed the states to amend narcotics regulations through response was very poor, though the response of this act was very poor. In 2008, Kerala became the first state to announce a formal palliative care policy. In 2012, Government of India launched National Program for Palliative Care NNPC. 2014, landmark of NDPS Act amended simplified legal barriers to opiate access nationwide. Quality of death index in India and India standing. Quality of death index measures the end of life care across 40 countries, evaluating basic end of life care environment, availability of end of life care facilities, cost of end of life care, quality of end of life care. Unfortunately, India ranks at the bottom of quality of death index overall score. It soars poorly on indicators like knowledge of hospice care, replacing general lack of awareness, which is reflecting lack of awareness in general. Main barriers identified including poor access to pain relief, lack of palliative care at national level, and cultural taboos.